Welcome, everybody, to episode 21 of PT Shop Talk. On today's episode, we go to PT Court, where Nick Doling tries to defend trigger point dry needling against Casey Hansen with Judge Jeremy ruling. We also are going to finish out with a little bit of our top 5 barbecue and outdoor gathering essentials list in preparation for Memorial Day. With me today, as always, is Nick, I double fist brats, Doling, and Jeremy, gasoline, pretty much lighter fluid, Van Klompenberg. Welcome, gentlemen.
Welcome. Can we kick it off with like the boys are back in town?
Keep going.
We took a week off. Right?
Yeah, we did. Oh, I didn't even mention that. I'm sure our audience noticed. Stats have taken a hit, so we are back. We are back.
We're back. Everybody.
Ooh, yeah. No, we got it. If the podcast thing, this doesn't work out.
Back. All right.
Oh yeah, I'll clip that. We can clip that when we start doing promos.
Save that for sure. Yeah.
Yeah.
All right.
Yeah, it was first break since we started this thing. So
is it an honor being around you gentlemen in person? I mean, we got to do that last week.
Yeah, we didn't even take a picture. We could have posted it. I'm trying to do more social media.
Should have reenacted the logo.
Oof, I know. Yeah, the social media thing's always a struggle for me. I'm trying to take that over. But I heard you had your own struggles with social media there, Nick.
Ooh, nice tee up. Yeah. So actually our stem, this is more related to my wife, Michelle. And this stems back to last July. I think we were on vacation celebrating our anniversary, 15 years last year.
Congrats.
And we're down. Oh, thank you.
You're kidding.
So this goes back to like last July, and she starts freaking out. She's like, I'm like locked out of my Facebook account. Somebody, I don't know, hacked it. And time went on, they froze it and kind of restored it back to her and all this stuff. And then last week, somebody took it, or maybe it's last weekend, I can't remember, but whoever it was that hacked into it is back on running her profile and changes the name even from Michelle Doling to like, vaguely was kind of Chinese name, like Lua Zhang, and starts posting pictures that Michelle had, like re-uploading as like a new, like replaces the profile picture with like one that Michelle had of her and her dad. And
this is her actual account, she didn't just like create a fake account.
Burner.
No. This is so in the time since Michelle has,
what is the end game there?
Like a new one. I have no idea. I'm like, what is this person getting out of this?
Just friends, I guess.
Yeah. And on that note, so you talk about how superficial social media is. So whoever it is that goes and finds a stock photo of Michelle and her dad from wherever in these archives, right? And goes and reposts it, like change their profile, right? And there's like 12 likes of friends that Michelle has, friends and family members, who all like this picture. And I'm like, does anybody pay attention to what's going on, or you're just cruising through on your feed? You're like, you're like, oh, nice, Michelle's
smashing likes.
Her dad, okay, like
what
that,
a hit.
right?
I like your new nickname too, Michelle. Zhang Jing.
Zhang Jing or whatever.
Don't judge me.
Yeah. Well, everybody gets to do what they want. I get it.
Yeah. But we've all kind of like, anybody who's aware of it now is like, block this person.
So can she still get in, or she's out again?
She's out of that one. She can't access that one.
Okay.
So she can.
So she has so this is her old account and she made a new account, and Correct. This person reactivated her old account?
Yes.
Oh.
It's like, and I don't understand the end game there, but I mean, we all like look at it in Big Stowe today. Like Wade Fliggy told us, like, oh yeah, if you get an email, like it's like a phishing email, phishing scam, or somebody's hacked his account, shooting it out. It's like stuff happens almost so routinely now.
Yeah, for sure. I don't open emails from anybody, especially like admin people, because that's pretty common. I don't know what they. I mean, I suppose they get a million emails and they're just firing through them. They're like, oh, bloop, yep, check out them. Let's hit that link. But yeah, that's crazy. I had somebody like copy my account, right? They took my picture and made an account with my name, and like added, I must not have had my friends private at that point or whatever technique they used to get up, but they started adding my friends and everybody's like messaging me.
Yeah.
It's like, hey, letting you know your account got hacked. And I'm like, well, two things. Clearly it's a different account because they're asking to add you as a friend. And B, why would you message my account telling me I got hacked if I've been hacked? So people's like understanding of the internet is surprising to me. I'm like, just don't. And I had to make this like big announcement because like 30 people, and I'm not a big Facebook guy, but like 30 people message me. Yeah. And then there's a few of my friends text me too, you know, and it's like, make this announcement. It's like, hey guys, I don't know if you know how the internet works, but like these are literally separate accounts. Like I could pick anyone on my friends list and make an account with your name on it and take a picture, you know, Google you. So it was very interesting. It was very frustrating because people were
what's
like,
the end game and something like that?
A good question.
You know, if a few of your friends like them, then you have access to their profiles, so you can start finding out about them. You know, people post dumb stuff. You post where you live. You post what your kids do.
Yeah.
You know, so I mean, it's creepy, but you know, you start to learn about people, and I don't know. Eventually, you can maybe open up a credit card, and you find out some of that stuff, and you know, you just got to be careful with that. You know, just knowing about people, you can find out some interesting stuff, and then they can message your friends. You know, like, hey. Because I've had
What's
that
your
happen.
debit card pin?
Yeah, because my friends always ask.
Well, there's some other. I mean, there's some. I see. I follow a guy named Tim Kennedy. If you guys are familiar with him, he's a former Army Ranger, mixed martial artist guy. Pretty cool dude all around. And he posts probably once a month. He'll do a post where he's like sharing screenshots of where people have taken his pictures and used them kind of identity theft in a way for like creating profiles like catfishing stuff. So like whether it's dating or whether it's trying to start a business, and they're using his stuff, you know, because he's a jacked handsome guy, and they're like, you know, so setting up the dating profile. Ooh, Jeremy.
Oh no. Winking about myself. Thanks, Nick.
Oh. I thought you were just alluding to other people on this meeting. But
no, I'm not kind to other people.
You're just an egomaniac.
Yeah, 100%.
Total e-personality.
Only feedback we get on this show. It's weird. I don't know. That's why I've been so minimally social media, but as you guys know, running a business and things, you just can't ignore that stuff. So getting into it now more, and with this podcast and things, I mean, I've been involved more I probably posted more on my Facebook about this podcast than I posted about any other aspect of my life. And we've
as you should
21 episodes, so
it's electric.
You forced me to as well. I'm also not a social media person, and that's probably the most I've posted in 3 years.
I still have yet to like anything other than my own posts, which seems weird. I don't know if you're supposed to do that, but I do it. It seems very like self-centered. Yeah. Nobody's called me out on it. I don't know how you would know. So it's social media was simpler times back in the day. When did you guys get on Facebook? Like initially?
Ooh, that would have been
grad school.
Yeah.
But it was like pretty infant then.
Gosh, it probably would have been like 06 maybe.
Okay, not too far off.
I was well into undergrad,
because
back when you needed a school email.
Okay.
Yeah. Yep.
Yeah, I remember like the buzz when they were like NDSU got added to the Facebook server list or whatever, and it was like, what the hell is Facebook? Like, I was still pissed off about text messaging people at that point. Like, I was like, why would you?
I was late to everything,
to text somebody, man. I was super pissed about that, and now, God forbid, I have to talk to somebody. So, I mean, I get it.
But I converted on all that stuff. I was a diehard like anti-DVD guy when that came out.
Oh wow!
I'm like, why am I going to replace all these VHSs for $20 a piece?
Oh man. Yeah, I can't watch a VHS. We still have some, and it is hard to imagine. I must have thought my eyes were so shit back then. Like you can't. That's
It's
so
just
blurry.
what it was. It's just what it was.
You didn't know anything else.
I know, it's wild.
Life was great. Now I think we're so spoiled by everything. Nothing's fast enough for us. Nothing comes soon enough, right?
No.
Yeah, that's a problem for sure in society. I don't know. Maybe it's just my kids, but I see that, like, to sit down to watch like a Disney movie, that is a struggle, man. These kids, they want to do something like, even to like sit down and play like Zelda with my son. Like, hey, check this out.
What Zelda?
So we don't have a lot of new video games. So I've been playing the Wind Waker classic. I thought that would be his favorite of them based on the animation style.
Yeah.
So yeah, like even that, he's like, like, man, as a kid, like I would cut grass for hours just looking for rupees. That was the life I lived. Like,
same.
What's your call,
Majora's Mask?
What was your take, Jeremy? You were gonna say something.
Oh, you were talking about VHSs. I was gonna say, even watching sports now, it's like when the camera pans on the court or on the field, it's like you feel like you're right there. And you watch some of the old games from like the 80s, and I'm like, man, it'd be cool if they had a way to remaster it,
upscale it.
Yeah.
There's stuff I like about that though.
Yeah,
I don't know.
It's cool.
I'm kind of a sucker for nostalgia too. I mean, I think a lot of people in our generation are, but when I see just the little bit of graininess, I mean, I dig that.
Yeah,
so,
like
that's just me. Yeah.
I play games on my computer and you can add scan lines and stuff back to them, so it's like playing on an old TV. I like it.
But you're right. Like the NFL is nuts when they cut to commercial. Like right before they cut to commercial, and they got a camera right behind like Dalvin Cook, and they're following. Like it's like you're right there. You can touch.
Yeah.
Hi, chef.
Keep cooking.
It is the world. It is the world we live in.
So VHS, you could watch Pet Sematary on VHS.
Is that how we're doing this?
That's how we're saying. So
wow.
I understand you are familiar with like Pet Sematary as well.
Yeah.
You could have went All Dogs Go to Heaven.
Yeah, that would have been nicer. Or anything other than my pets coming back to life to murder my family. Yeah. So you guys are pet folk. You guys have pets, right? Jeremy, you got a dog. Nick, you have a dog, right?
He has like a
horse.
friendliest damn huge dog ever.
Now
that's right.
Go on, Jeremy.
No, I was gonna say he's like a freaking horse. I mean, it's like that's what I said earlier today. I'm like, if it's not 75 pounds, it's not a dog. And mine's probably 95 pounds.
A lot of dog. So here is the issue, and I'm curious how to handle this. So I now have a dog, which that's a whole nother story. But kind of anti-dog, but I own one. Also we had a cat. It has made an appearance on this podcast a few times. If you're a YouTube watcher.
Yes.
He has moved
right back there.
Yeah, right over there.
Over your right shoulder.
So he has moved on to whatever cats do. Purgatory, I would assume, based on their attitude. So very, very interesting to me. I grew up in the country, and when a pet died, you put it in the fire, and then you threw it with the rest of your garbage into like a pile. That's what we did with our animals. Like
we didn't burn them. We just we took them. We had a bunch of what we called shelter belts back home, also known as a tree grove if you're a Minnesotan.
Grove.
Shelter you from the wind.
Grove.
Named.
Shelter belt, as they were referred. And we had one that my dad and all of us coined the dead animal slew. Okay. So we had any butchered cattle, any dogs that may have passed, except for a couple. When us kids got old enough, me and my brothers, we would, if we had a dog we were fond enough of, we would give it a real burial. Like we would legit go back to the grove that was right behind our house, dig a little grave and bury it.
How deep do you go? That is question number one.
I'd have to ask the 9-year-old version of Nick.
Okay.
And he'd probably think it was 12 feet, but in reality it was like 2.
Yeah, because I'm not gonna lie, man, digging a hole is hard work. I don't know if you guys saw the guy that like killed his wife and then tried to bury your body and then had a heart attack and died while he was trying to bury your body.
No.
Yeah, but that does not happen often. No. But still, hole digging is tough. So we had a cat die. And it's like, I don't know what to do with this thing, because normally I would put it in the burning barrel and then I would move its ashes to our junk pile, because that's how
Get
we
an
do it in
urn.
the country. The
Get an urn.
EPA doesn't
Get an
have to know.
urn.
Yeah.
Undertaker style.
You could get a buffalo urn to put by your nickel.
Oh,
behind
right
you.
behind us, so he could
Yeah.
still be here.
Yeah.
Yeah,
With you forever.
my first inkling was to just put him in the garbage. Right? Like, well, the city's gonna take him.
You have no soul.
Now,
But it's a cat, so I'm not totally sympathetic.
and here's the
to
thing,
this
he was an okay cat. I mean,
death.
right, like we had a previous cat that passed away, but she was like at the vet in surgery when she died. And they just like were like, well, we'll just cremate her and we'll just write it off or whatever, means we're right here.
Dump
So
her in the bin out
we
back.
did have to throw in
Find
the
the
garbage.
evidence.
Right. So we do have like a little thing of cat ashes.
Yes.
But I
Get
was like,
another one.
well, but like that seems like a lot of work. Like, again, I put him in the garbage, but I don't think my wife would have liked that. And then I was like, well,
How does she have to know? Why do you have to?
Exactly.
It's not like you're not thinking of putting it in like your kitchen garbage, are you?
Well, like the garage garbage. So like the
There you
garbage pickups on Wednesday. The cat passed on Tuesday. Like he'd only be in there for a day, but I feel like I'd have to like cover him up in the garbage.
There's
right?
no
Like,
chance you're gonna get busted, dude. Why didn't you do that?
But do you think at some point she's gonna be like, so what? Where is the cat? Like, should I have just like dug like a
could have
little
said
bit
buried.
of dirt and then just put it back and been like, oh
I
yeah,
laid
I
it
buried
to
him.
you laid it to rest. If she
Ooh.
does she need more details, be like, I'm sorry, you're that morbid. I don't feel like opening up and sharing.
Yeah, you should.
It
meet
was
my
really
wife.
tough
I
for me.
don't.
Tough.
She knows me well enough to know like I need to ask more questions. 'Cause-
She immediately would have said,
yeah,
"You
show
put it
me
in the garbage, didn't
yeah,
you?"
right. She's like, it didn't fit down the disposal, so you put it in the garbage, didn't you? And I'm like,
that would be brutal. You'd have to snip it up first.
well, yeah, I like pieces. I'm not an animal, Nick. You gotta run the water a little bit first. Yeah. So, but then I was like, how deep do you bury an animal? Because I was like, well, maybe I'll just bury it, like, because we have young kids, 5 and 3. So I was like,
Yeah.
should we have a ceremony?
Yeah.
Who read
Let the
the
kids
Rainbow
do it.
Bridge? Who read the
Hey.
poem? Rainbow
Is-
Bridge.
I don't even know that poem.
Go ahead.
Oh,
Tell
look it
us.
up.
Yeah, hit it, Jeremy.
Say it, Jeremy. Fill us
Yeah.
in.
Ooh, well,
Somewhere
I
over
can,
the
I
rainbow.
can produce this.
Yeah,
Well, I
produce
thought-
it while we're
I
talking.
thought you
But
were gonna
so
just spout it out. Just
So I was like, so then I was looking up cat coffins. Like that's apparently a real thing.
of course it is.
They're like $200 for like a metal cat coffin with a velvet lining. That seemed ridiculous. Again, we've moved from garbage to $200 coffin.
Compress it and make a jewel out of it.
Like the
You could
whole
have a
cat.
necklace. Yeah,
what
the
kind of
ashes.
press do you
You
have?
can take.
Oh.
Holy
No,
moly.
I think you can do that. I think you can. You cremate them and then they can put it in a necklace,
Like press it into
a
like a
stone.
little baby
That-
coffin.
I guess you. I don't think you want to have a
Very
baby
powerful.
coffin compressed out of ashes, Nick. You.
Where is
you
this
moved.
going? What are we talking?
I don't
So
know.
you're
I'm
looking at how, like, just
Hey,
bury it
how-
and move
yeah.
away.
How deep do you bury
Oh.
an animal? Is really what I'm looking for.
This you wouldn't
And
even need to.
3.
You wouldn't even need to bury it.
Well, I feel like again, I have to have evidence I did something because I don't think my wife will let me throw it in the garbage,
There's one thing right here. It's
and it
called
won't fit down the toilet. It won't flush like a
Eternova.
fish.
diamonds from ashes.
There
It's
you
just-
That's
But is
probably
this-
going to be more than $200.
Do you
But is
have a
that for
truck?
pets or like human beings?
It's for pets too.
Oh, you can do it all.
Only remarkable pets though, because
He
you
doesn't
said
qualify.
He's
then.
okay.
Yeah.
So do you have a truck?
No, Yukon. I mean,
Well, you could put it in a couple garbage bags, put it in the back of your Yukon, and go and find another place far from home and dispose of it.
again, I feel like you guys are missing the point. Is my wife's gonna wonder what happened to it?
You
Like,
took care of it. That's all she needs to know. Like
man. All right, you guys.
Petey didn't
Bury
have
it.
it. I took care of it. What did it die of? Natural causes, or do you suspect foul play?
Yeah, we got a new dog. He's never seemed happier since he passed. So this is questionable.
Cats are assholes though, so I don't blame your dog.
Yeah, no, he is exemplified cathood. He was as a butthole as cat get.
Yeah.
But
Yeah.
I still, for some reason, my kids still miss him. Have you guys ever had to have that conversation? Probably not you, Jeremy, but Nick, have you dealt with that with your own children?
Fish. The kids kind of
Okay.
overfed the fish anyway. So I mean,
You're like,
had
you
that-
murdered him. Were
they-
you
yeah, they
real
wrestled
straight
with
up
that
with
guilt.
them?
I mean, and I didn't even have to tell them that. I mean, they figured it out.
Oh,
And
wow.
yeah, that was pretty dramatic. And I did flush it down the toilet. Like,
Did you have a fish ceremony? Did you read the rainbow song?
I
Rainbow
didn't
Bridge.
know I did
Rainbow
not know
Bridge.
Rainbow
The
Bridge.
poem.
Can you recite it now, Jeremy? So we're up to
No,
speed.
I'm not going to, but I want you to look it up. It's like when a special pet goes to heaven, they're in this meadow. It's the Rainbow Bridge. I can't believe you guys have never heard about the Rainbow Bridge, but I actually can.
You're talking
you
from a
put
man who,
animals in a bird pit.
yeah,
Pretty
in a
sure when-
slough, like
I'm
throw
like-
the water will take care of it eventually in about 50
Yeah,
years.
that's how I grew up. It's like, God, we went through so many dogs growing up, cats. And it was like,
Yeah, we did a lot too. Yeah, cats were. That was a.
my sympathy, like I
difference.
love our dog, I do, and I know when he finally, our dog's 16, and when he finally passes, I'll be sad. I know I will. But at the same time, I mean, I grew up just like every 6 months we'd have another dog die due to either being hit by a farm vehicle or being hit by
That is a
vehicle on the
hard knock
highway.
life, as they say.
Yeah,
Yeah.
you just get used to it. And then I'm jamming out, not singing poems, but I'm like, I don't want to be buried in a pet cemetery, right? Ramones. No? Do you know they did a theme song for that movie?
That's interesting.
It's a punk
So
rock
that-
song. Check
So
it out.
every time a pet died, that's how you jammed
I
out.
sing it. I kind of think of it in my head.
So you have
Look it
an
Music
old
video
dog
and everything.
now. What's your plan? Your garbage in this thing when it's all said and done? I
Well,
mean, I hate to put you on the spot because you said
we
you're
live
a
dang
little
near out in the
attached to
country
it.
now.
Yeah,
We live dang near out in the country. I can basically go a couple lots back and bury it.
that's the plan. Or have you thought about it?
I don't know. I'm not. That just
Ooh.
scared me now. That's
Yeah,
what
you're-
what I'll do.
Yeah, you got.
You're gonna need to
think.
stuff. You got to stuff dolls.
Now, would you
Keep
do it
them-
yourself? Would it be like a project, like a DIY?
hire a taxidermist. It's not a labor of love.
You hire that one done. It's
Yeah.
got to be special.
Would it be special if you did it
You
yourself?
make
Like,
him look like he does. Make him look perfect.
Looks like some child drew a picture of a dog, and that's what you have
Just carry him
stuffed in
around.
your house. Yeah.
How
from-
trippy would that be if I show up to like site visits with this stuffed dead dog?
You
Yeah,
put like
yeah.
a little vest on him, like a
Keeps me-
support animal, right?
Support.
Don't look him in the eyes. Don't touch him.
He brings me peace, guys.
Yeah,
This
see?
is going to be a really controversial episode.
Do you think
Do
that
we
many
have-
people
do we
are
have
just pet
serious-
lovers?
Oh yeah,
Oh,
everyone's
man.
a pet lover.
Yeah, my whole
Mr.
family.
Come, Mr. Bigglesworth.
There are meadows and hills for all our special friends, so they can run and play together. There's plenty of food and water and sunshine, and our friends are warm
Yeah.
and comfortable. That's
Yeah.
just part of it. Like you got to do that for your cat. You just
You
got
gotta
to
do it, and you gotta do it
And
for
for
your
your
kids. For your kids.
read the Rainbow Bridge
Oof.
Yeah.
or delegate it.
Yeah, I wanted your input, but I've sent him to be cremated is actually
at
what I
you. You did.
decided to do.
You're humane.
Because again, I had no idea how deep I had to dig a hole to put a cat, and that seemed like a lot of work. If I'm gonna be honest.
2 feet. 2 feet.
2 feet.
Well, why do you have to bury people 6 feet? What's the
Oh,
difference?
There's like a coffin. There's a coffin. And there's like respect you gotta give. It's a human.
Isn't it
being.
the
Just put?
freeze
Ah,
line?
ooh, wait. It's garden season.
Yeah,
You bury it in your garden.
till
let
it.
decompose.
Oh, okay.
Oh yeah. Yeah. And then all of a
Just
sudden you
like-
got some fertilizer.
Just like cat vegetables, huh?
I guess
Oof.
it works.
Yeah, I missed opportunity, I guess. Yeah, I went with the burn because I like called the lady. I was like, hey, I have a dead cat. Like, what are my options here? And she's like, well, you can drop them off. And I'm like, I'm super busy and I don't really care that much. And I'm like, can I wait until like I have some free time? She's like, he's gonna start stinking
Yeah.
pretty quick. Yeah, you can't sit on a dead animal. I found that out as well.
Yeah, it's true.
He was like, 24, man. You're probably gonna want to do something with him within that first 24. Because I'm not gonna lie, he was stiff. Boy, he stiffened up quick.
Did he bloat up a lot?
He was pretty bloated before he died. Probably why he died. Part of the reason there. I mean, it was hard to tell. I should have poked him, I guess, and saw what happened.
You poked him with a needle?
Yeah, my dry needles I had. I don't think he had any trigger points, but he could have popped.
You probably let him go without proper care, and he died of them.
Oh, because as
trigger
we
points.
all know, trigger points can cause other trigger points. It is a cascade effect.
Can you prove that it doesn't happen?
Yeah, I guess. For sure.
Beyond a shadow of a doubt.
Prove it.
Yeah, I think you could
Dude.
probably need to prove that the other way more.
Can you support your thought?
I think you need to prove something exists more than you need to prove something doesn't. But
we need like a theme for this segment. This
Potato.
new segment.
Potato.
PT Shop Talks. Yeah,
PT
that's the people's court, right?
Yeah.
Yeah, do it, Jeremy. Go.
That's all I had.
Do it one more time. I'll clip it.
Judge Wapner.
PT court. Disclaimer. As we go through this defense, we are not legal professionals. I am not a lawyer. Nick is not a lawyer.
Nor am I.
Jeremy,
I'm not a judge.
not a judge.
Not a judge.
What we use for terminology, most likely incorrect, taken from television, maybe some books, and cartoons.
Movies. A lot of movies in my case. Yeah.
So
Objection.
Oh, nailed it. So
I think you have to do that.
Wait, I'm the judge.
Yeah, I think you have to overrule it.
Yeah. Oh, yeah.
Yes.
Continue.
Or sustain. You say
Sustain.
overrule or sustain.
Sustain. Yeah.
So we're gonna try this today. We are going to do a little PT court. We are gonna talk about trigger points today. Whether trigger points are something we need to be worried about, or even if they are real. So,
Ooh.
Oh, I didn't know you're okay.
Jabbing the needles already.
I will be going after trigger points a little bit, and Nick will be defending them. So I will let Jeremy lead us off a little bit about what we're talking about while I get prepared to prosecute.
Your opening statements.
Well, essentially, what we're looking at with a trigger point would be a irritable or hyper irritable point within a muscle, sometimes called a knot or a taut band. They may cause pain over an area, can reduce flexibility, and ultimately, potentially, can reduce muscle function.
Mm-hmm.
So that's what I got, Case. That's what. How far you want me to go into those?
No.
Yeah. You're putting on your blazer?
I was so gonna wear my suit coat. Casey before this was all like, this is too gimmicky. Blah bitty blah.
Feel better already. Let me get my legal briefs out.
Does this mean I've lost already?
Pretty much.
I've prepared a statement for everybody. For those of you watching on YouTube, I've moved into Casey Hansen Esquire. So today, judge, listening audience, I am going to propose to you all that we need to move on from treating trigger points and for even using that terminology, as I believe it's hurtful to the profession and it's hurtful to our patients. So, to start with, though,
objection. How is it hurtful?
Jeremy?
I think you need to clarify which
sustained.
ways it hurts.
Continue.
I will get to that. Thank you, Judge. So, I feel like first part of describing why we need to move on. First, we need to talk about what Jeremy talked about, definitions of trigger points. what they are and are they really there? You know, if we look at the origin of trigger points, long time ago, and I have research to back this, but I'm not going to go too deep into it because we did not approve all our evidence prior. I think you're supposed to do that.
That's
so
true.
I will use
You're
it.
supposed to
Nothing was entered. Disallowed. Disallowed.
I will
Sweet.
enter it. I will enter it as I go.
That's another win for me.
So this all started way back. A gentleman by the name of Stockman described fibrotic areas of tendons as generation points of pain. Really, he said that there was chronic inflammatory hyperplasia, fibrotic tissue and patches, and that moved on to never really proved that. He never had any evidence to prove that. But what happened next is we looked at Janet Travell. She was probably the first major trigger point person. She was, I believe, a physician.
Correct.
Thank you, Judge. And she ended up being, I believe, John F. Kennedy's
Correct.
private physician. Correct. And she theorized very similar to Stockman's deal, although she talked about pain felt in voluntary muscles is myofascial in origin more so than fibrotic tissue on tendons. And she claimed that these trigger point areas can maintain what they call an indefinite pain cycle. So these areas, as Jeremy said, they start to get intense, they cause pain, the pain causes more pain, which causes more trigger points. You got something over there, counsel?
No, I'm just for anybody watching on YouTube, this is what happens in movies, right?
Yeah.
And
Oh, you're talking to counsel.
My little needles.
All right. Oh, you got needles over there? You brought weapons into court today? Who's
bailiff? Bailiff?
Yeah.
Bailiff?
Your honor.
How did you get those?
That,
are those non-magnetic, I suppose? Titanium? Stainless steel?
I asked the Mr. Prosecutor stay on topic, sir. In the interest of everyone here, I asked that he stay on topic.
Overruled, Casey.
Overruled, I have to stay on topic, or overruled, I can keep yelling at him?
You have to stay on topic.
Oh, okay. So moving on. So Travell and Simmons was the person that kind of jumped on board with this whole thing, formalized this construction of myofascial pain arising from trigger points. Without a whole lot of evidence to back that up at that time, you guys would recognize Simmons as being really a strong medical person because they were famous for being an astronaut. So those are the people that developed trigger point therapy and the idea of it, JFK's doctor and an astronaut. So there we go from there. And, you know, again, they described it very similar to how Stockman described trigger points. They didn't really pull anything through there, but what they did bring to the table was these maps. These maps of, if I press on a trigger point, this is where the pain would be referred to, because that was a big thing with trigger points at the time, is you had to press on it, it had to be referred pain. Well, if you've seen the charts, we press on a trigger point and you might have pain in one of about 1,000 areas, and we mapped that and we made what looks very similar to dermatomes, myotomes, because it probably follows nerve pathways. So very similar. And if you look at back at the time, they even said some of their maps of trigger points were just kind of put together because they didn't have enough information to actually use them. So again, the theory of trigger points encompass two things. Trigger points, a local area of tenderness and hyperirritability, could be located in the immediate region, and it worsens with palpation and cause radiating pain. Can we agree on that as generalized trigger points? Nick, I've put you on the stand for one question.
I don't think that's how. I think you either say like no further
call to the
comments,
stand.
Yeah,
call to the stand.
Called to the stand, Nick Doling.
I don't think you can
you've
call
heard
me
my
to the stand.
testimony. Can we agree on that as a trigger point moving forward?
You could just say no further comments, Your Honor, and then it's my turn.
No, I have many further comments, Your Honor.
You should stop right there.
No further comment. Yeah, I gotta get my terminology down. Doling, continue, rebut.
Yeah,
Correct.
would you like to rebut just that basis
On that
of the
point,
history of
Your
trigger
Honor. Okay, is it my time yet, Counsel?
Correct.
Is it my time? Okay,
points? Sure.
all right. Thank you. Your Honor, my esteemed colleague, Mr. Hansen, would have you
Esquire.
believe that he would have you
I'd
believe
like the
that.
records to show that, please.
Casey,
Yes.
when did you say Janet Travell was practicing? She was Kennedy
I
administration,
don't know.
correct? So you're
Was
talking
Kennedy
1960
the
to
60s?
1960, 1963. Sadly assassinated. Sorry you'd bring that up.
Not because of Janet Travell. Zero involvement with the
Correct.
assassination. As
My
far as
understanding
we
was she
know,
basically kept him up. Is it my time?
Correct.
Thank you, Your Honor.
objection hearsay.
So my esteemed colleague, Mr. Hansen, would have you believe that there's been no additional research taken on this topic since 1963, potentially, when Janet Travell initially drew out the hypotheses for this. So, which in fact would be incorrect. We all know that there's been an abundance of supportive literature in favor of trigger point dry needling, somewhat in isolation, but predominantly as a part of a multimodal approach to improving patient care, improving patient outcomes, particularly with chronic pain, and specifically in the spinal regions, cervical and lumbar. No further questions, Your Honor.
I
Comments?
would.
I didn't really ask.
No further
questions.
comment?
Yeah, I would love to rebut that. Yeah, and ladies and gentlemen of the podcast, Judge Jeremy, I do not mean to turn this thing into a straw man argument about trigger points and dry needling. I am not here to argue the efficacy of dry needling. I am here to argue the fact of trigger points and their use and diagnosis and cause of pain. So in that, as we talk about research, I would like to discuss the plethora of research trying to determine whether trigger points are real or not. So again, we ran into an issue with trigger points. It's a very circular argument, right? My muscle hurts because I have trigger points. Why do you have trigger points? Because my muscle hurts. So that initially is a very tough argument to prove or disprove. And we will see that when we ran into issues with this with Travell, Simmons, later Jan Domeralt, when people asked, well, I have trigger points that as I palpate muscles, I palpate a taut band, it doesn't really hurt. What's going on there? So instead of proving trigger points existed, what they did was they created a category for them. Oh, those don't fit our model. We will call them latent trigger points. They may one day, a long time from now, if you do things wrong, cause you pain. So instead of proving trigger points, they created a circular argument that you can always have trigger points and they can always be present, but maybe not cause you pain. So the medical community said, oh, that's pretty sketch. Let's try to prove these things. So how do we prove it? Palpation, that's a big one, right? So we must be great at palpating trigger points. Because if they're real, we should feel them. So there's been some pretty interesting research about that. Again, I'm not going to get into individual articles. I will point you guys to some references at the end as an aside from this jury thing that you can kind of go through and wade through on your own. But we found with trigger point palpation, if we told somebody, if we took seasoned clinicians and we said this patient has a problem with their shoulder, they have chronic pain or myofascial related pain syndrome, I guess is kind of the big one. And it seems to be located in their shoulder. That seems to be the area they have most difficulty with. Seasoned clinicians were very good at finding those trigger points. Pretty decent interrelated reliability. They said, oh yeah, shoulder. I palpated the shoulder. This is the spot where it hurts. If they took that away and they said this patient has myofascial related pain syndrome, we'd like you to identify where they're having their problems. it went from about a 70% reliability rate way down into the 30s, low 30s. And this is with the same seasoned clinicians they used when they gave diagnosis. So we find that if we can't prep people and we can't lead them to believe what they're trying to find, they can't find them. At least not very reliable. Less likely than pins and needles flipping a coin to determine where it's going to hurt. So we start to find that palpation's pretty unreliable as a diagnosis for trigger point. And I would also argue in that same fashion too, when we talk about identifying trigger points, we sometimes forget about like a meiotic reflex in muscles. And that's probably part of what leads people to believe if I know it's in the shoulder and I look for it in the shoulder, I'll find it. Because what happens is, and you at home and in the courtroom can do this on yourselves right now. Take a muscle. I use my forearm. Gently press into it until you feel radius or ulna, whatever. Likely not much you feel. Take that same muscle that you push through, rub back and forth on it in increasing intensity, and pretty soon that muscle will get firm. That's a meiotic reflex. It's the same reflex, similar anyways to what you'll find with patellar reflex. If you push on something hard enough and fast enough, muscles respond by tightening up. So when we tell people, hey, my shoulder hurts, and you rub on teres major, likely they will start to get tone there if you push hard, which seasoned clinicians will do perpendicular motion along the muscle fibers because that's what they're taught. And they may create some of these issues. And you know what? If that's not the area where the patient feels the pain, don't worry. That's a latent trigger point. So we can't palpate. We can't palpate. At least reliably. So let's move on. There's got to be other ways, right? These trigger points are real, so we can find them. How about we look at histology? It must be different, right? You have a muscle that's constantly firing. It must look different. But it doesn't. We look at histology. If we take a patient that has myofascial-related pain syndrome, and we take histology of the muscles that are sore, we do find increased substance P. We find increased immune response hormones. So those are all great. Okay, something's going on here. If I take that same muscle on the non-involved side, I find the exact same histological changes compared to normal tissue. So we're not finding anything histologically really that's different from a trigger point to a good healthy muscle, other than the fact that the patient's having a lot of pain and swelling. And that swelling response, the immune response, surprise, surprise, is systemic, and it's everywhere, not just in the trigger points. But Dr. Hansen, Esquire, what about end plate noise? That's a thing, right? Trigger points have end plate noise. And you would be correct in that assumption. When we do EMG studies on quote unquote trigger points, we do find that there is end plate noise almost always. As we put a needle in there and listen, we have end plate noise. Again, those same individuals, if we put it in healthy tissue, will have end plate noise. Is it the needle going in? Is it random end plate noise that we're capturing? Hard to say. Research can't support that either way. We do know end plate noise, if you believe in trigger points, is always present, but it's also present in non-trigger point tissue.
Doling?
Thank you, Your Honor. I was
I was trying to produce the term for, all right, hold up, Esquire, and let Doling talk.
Yeah.
I couldn't find it.
No, you raised some interesting points, Mr. Hansen, Dr. Hansen.
Esquire.
Thank you, Judge.
Esquire.
Let the court show that, please.
Strike
you're
I'm
speaking
wearing a tie.
Oh, I could grab a tie too. I forgot to, or I chose not to.
Could you?
Whichever. Yeah, I could. I have like 40, at least maybe 45.
Wow.
For that reason.
What do you use those for? You timed your mic stand when you sing Aerosmith songs?
Your Honor, am I allowed to go on? he's badgering. He's not just badgering a witness. He's badgering the defense counsel.
As they deserve it.
Now, as far as tissue histology goes, I happen to have some notes myself up here. And, in an article, we're talking about ischemic environment within this trigger point. So you talk about histology and an absence of, you're talking about an absence of healthy blood flow, proper oxygen levels. Yeah, in an article by, Blaine and Shaw, using ultrasound to help determine the characteristics of myofascial trigger points associated with cervical spine pain, they're finding that there's a much lower level of oxygen present in those tissues, leading to a lower pH and a more acidic, painful environment, causing the body to respond to the collateral pathway for blood flow that goes outside of the myofascial trigger point, creating more of a radiating pain syndrome, leading to the hypothesis of taut banding. Now, I'm not going to totally disagree with the prosecuting attorney's point on the maybe poor ability any therapist to properly palpate and identify a trigger point. I think it's been well researched and proven that our palpatory skills as a collective profession are poor at best when you can compare inter-rater reliability. Whether that is palpating trigger points that are perceived to be there, or whether you're palpating vertebral columns and levels, other bony landmarks, etc. I think that's been proven to be false time and time again, and very poor. So as far as being able to correctly identify trigger points, I think that makes that argument fairly moot, because it calls into question fairly everything else we do from a manual therapy standpoint. Now, additionally, there is a nociceptic environment within this, within painful trigger points that I believe you would be familiar with this, Miss Dr. Hansen, Esquire.
Thank you.
That create a sense of allodynia. Sensitized nociceptor has lower threshold levels for activation and can thus be activated by stimuli that are normally innocuous. And
can you translate that for our audience?
So what that means is that you have an area, a very specific area of the body that you can provide, not necessarily deep palpation, as Casey was talking about, but more of a light to moderate approach to it. And it should be fairly pain-free for your average everyday person. But in these cases, it is hypersensitive and creates a response of pain, or interpretation of pain for that patient.
Proceed.
Yes. So again, it goes back to bottom line being poor blood flow, more acidic environment, lower pH. So there is something neurophysiologically going on within these specific regions of the body. Also reproduced again by Shaw in the Journal of Applied Physiology. And again by Shaw and others in the Archives of Physical Medicine and Rehabilitation, 2008.
And again,
No further comments at this time.
I'd like the court to show that's very similar to the proposal I made, where you'll see those ischemic changes, but not just in trigger point tissue. And that's where the danger in what we are saying and doing lies. We are saying these trigger points are the cause of, or at least the generation of, the nociception, which I would argue is not true. As we have stated, we cannot say these trigger points are pain generators at this point. I would even go as far as to say that, again, ultrasound imaging even has failed to really prove the presence of trigger points. We see a couple different studies where we talked about a mixed echoic area in rectus abdominis muscle. They found that, but they also found that again in normal tissue. So we're trying to find things, we're trying to prove things when really ultrasound studies, MRI studies have shown chevron type change in muscle fibers, but they were not able to prove that that was any different from normal tissue when we looked at trigger point tissue. And the authors of those studies with MRIs have actually sidestepped trying to even discuss it. So we're finding that ultrasound imaging, diagnostic imaging, again, is not proving that trigger points exist, which is where, again, we come back to my point is, are we doing disservice to our patients by telling them that trigger points are causing their pain? We already talked about.
Whoa,
Whoa.
get him, Judge.
What is that? That's not a law thing. Time out. Are we? What is it called when we both come up to talk to you?
Sidebar.
Sidebar. Are we sidebarring?
Yeah.
Is that what
Can we sidebar
in front of people?
Yeah.
Well, let's sidebar. I like that.
Is this where you tell? Is this where you tell me skating on thin ice?
Is this banter?
Just say that one time.
Are we bantering? Are we bantering?
Every judge that.
You are skating on thin. No.
Oh no. I thought it was at least an inch thick.
So we've got here both sides. We're talking basically, we can't really prove it, or well, no, there's some evidence to say they exist.
Very weak evidence.
Is that fair? However, what does this mean? You speak to danger, and I'd like you to go into that a little bit more. What does this mean for our patients? What does this mean as a technique? Can you expound on danger?
I would love to.
Why it is dangerous.
That's exactly what I'm moving on. So
Thank you, Judge.
Thank you. We
wrap this up.
So I think we can all agree now trigger points aren't real. Let's move on.
I object. I believe that has not been fully.
The record will show Dr. Doling Esquire's objection.
So as I move ahead in my brief here, as I had lots of more to disprove them, but we will move on. We've discovered. So if I don't believe trigger points, and I don't believe therapists should believe trigger points, so what's going on, right? That comes down to it. And how can we message differently to our patients to make our treatments better in the long term and create self-efficacy with our patients? Because I believe the danger in trigger points is saying that what you're doing is somehow creating trigger points. The trigger points are creating pain, which is creating more trigger points, and it's cascade effect that unless you take care of trigger points individually, they'll always be present, and you can't manage them on your own very well. So that's what I want to move beyond. And that's why I think when we talk about harm and how we message to patients, it's this rhetoric or this discussion that we have. I don't believe trigger point therapy is a whole lot different from telling patients that they're misaligned. I think it follows that same kind of reasoning as to tell somebody they're out, their SI is out, their vertebrae are out. Again, and I don't want to make this a straw man argument where I'm comparing trigger points to alignment, but when we talk about the message we give patients, we have to think about that. So when we talk about, and Dr. Doling Esquire discussed this, as far as hyperalgesia, why can't we just say that these areas, this same inflammation that we've seen, although it's systemic instead of local, as we know from histology, is a byproduct of whatever your history told us. You loaded something up too fast. You created injury somehow. You loaded something up too long beyond what it could tolerate, has created some inflammation. That inflammation has irritated peripheral nerves. Peripheral nerves follow myotomes, dermatomes. Roughly, they change daily due to plasticity of the brain. And that's why trigger point charts are so poor, because plasticity changes pretty regularly. So why are we saying that we're treating trigger points when why don't we just talk about the hypersensitivity? Why don't we talk about what you've done has created this environment where your body is hypersensitive and it's going to take care of itself. It's not a trigger point thing. I don't have to take care of trigger points for you to feel better, right? We have to get you moving again. We have to do those things we know decreases inflammation. We need to start walking. We need to start sleeping better. We need to start taking care of yourself better. And we need to find those tissues you overloaded and take care of them. We need to start loading them up or relax them back. We need to calm them down if they're too inflamed initially. You can't take something that's really inflamed and just keep working through it. I would agree with that, but I feel like this rhetoric of trigger points, which we've never been able to prove just creates a way for our patients to lose accountability. I think it takes away from how we're treating patients, because if you believe you're treating trigger points, that really becomes a maintenance deal in some ways, because if patients can't change their lifestyle, then they're constantly, every time they get pain, it's because they have trigger points, and then you treat the trigger points, which that could be another different story. A trigger point treatment, I'm not here to deny ASTIM, dry needling, massage. I'm not here to poo-poo those treatments, because we've all had patients have success with those. What I am here to poo-poo is how we, and poo-poo is a legal term. So
Yeah.
I'd like the courts to show
Accepted.
that. It's just, again, that reference point we talk about that can be dangerous. We see it. It's not trigger points per se, but I mean, even when we look at chronic pain as a whole, it's like, I just need to manage, these knots, this pain. They have a million different devices to manage that with little success and little improvement in some of those things that we've seen in the research and the long-term chronic pain. As we've developed more and more treatments geared towards trigger points, you would expect chronic pain and trigger point related pain to decrease, but we are only seeing an increase in it. So that's why I think we haven't proven trigger points. It's a cyclical argument. We try to prove it by giving no chance to disprove it. So Jeremy, sidebar.
All right. No, I want to give Nick a chance to jump in here and rebut.
Thank you, Your Honor. I appreciate it. I've always appreciated you as a man, respected the cloak and the gavel.
I'd like the court to show I also respect Jeremy.
Too late.
I did it first.
Ladies and gentlemen of the jury listening audience, I'm just a simple therapist. As Casey said, I'm not actually a lawyer. I'm just
these closing arguments?
These are closing arguments. This is the
take
closing
that Esquire right away from me.
Jesus God, he talked forever. All right. This is my closing rebuttal. I don't disagree inherently with quite a bit of what Dr. Hansen Esquire did present here today.
Thank you.
What I would counter propose is that treatment of that, number one, there is some, albeit weak evidence, but some evidence to show that their trigger points are real and that they are a home for some of the colloquial pain soup, as people have coined it. There's also very recent evidence that is moderate in nature. I'm going to reference the 2001 updated clinical prediction or clinical practice guideline on a JOSPT as far as physical therapy interventions for lower back pain, where they cite 3 separate randomized controlled trials that examined dry needling interventions provided by physical therapists to patients with chronic lower back pain delivered to what were perceived to be or believed to be trigger points.
Objection. That's a straw man argument. Dry needling and trigger points are separate.
They're not. We're using the dry needling to treat the trigger points, Your Honor.
That's if you believe trigger points are real.
Can you make him shut up? Isn't that?
You're in contempt.
Oh
no.
Patients
get
that
the bailiff right.
Nobody here is arguing the efficacy of dry needling.
They showed that the group receiving the dry needling treatment to their trigger points had greater improvement in pain following immediately following their last treatment session. There was unfortunately no long-term follow-up in that particular study. However, another study in which all participants received physical therapy with dry needling and another group, a control group that received physical therapy without dry needling. The group receiving dry needling along with physical therapy experienced significantly greater improvements in pain and disability levels at the end of their treatment and at a 2-month follow-up. Your Honor, my final point is this. I'm not saying that we need to prescribe to a cultish theory and that trigger points need to be the focus of our treatment with any patient with abnormal pain levels. All I'm suggesting is that it's part of our collective treatment to get the patient better, that we provide a service that they are themselves not able to provide themselves in some cases, and we can help them bridge the gap to independence by removing some of these barriers and functional limitations. I rest my case.
Cases rest. Would you bury that case 2 to 6 feet in the ground?
At least two.
Or would you cremate it? My closing arguments.
What
Again,
you can't close argument again. I get to go
never
last.
closed
I'm
my
the
arguments.
defense. I go last.
What? Oh, okay. Well, I still think I won.
Chair, you turn it to the judge for a ruling.
I feel like your closing arguments was just a straw man deal
Do
to
you have a
talk about.
bailiff? Do you have a bailiff you can toss him out?
No, the cat's dead. We talked about that already. He's
Bailiff.
gone. That was all he's good for. He was mean.
Take him away.
So I think both sides bring up some really valid points. I would say my personal viewpoint on, so I think we were arguing two slightly different cases. Casey, you really went at it from the do trigger points exist.
Correct.
And Nick was more arguing for the efficacy of dry needling. Is that fair?
That's what I felt like as well.
I do believe I had a particular rebuttal related to Shaw's research studies that did prove that trigger points exist, and there is increased endpoint noise in those trigger points.
So
Also increased trigger point and point noise in normal tissue as well. So
say that again. Say that again in English.
there's also been found to be increased end plate noise in normal tissue as well. So
this would be my take on it.
No, not according to my graphs.
Localized to just trigger points.
Well, let me pose this question. Does it matter if trigger points exist or not?
Yes and no. I mean, can we move beyond, and I'll give my articles as well, and you can use that for your own self. But no,
squiggly lines for endpoint noise.
Yeah, can we just sidebar and move beyond like the law thing? Just to chit chat now. I think I'll take the tie off so you guys know.
Well, we need a final ruling. Then we can move away from our shtick.
Well, come on. My Jeremy's gonna final rule that.
Here's my final ruling. I agree with both. I think in terms of, I do think we're trash at palpating. I do think there's some pretty weak evidence to say that trigger. I shouldn't say that trigger points exist, but I agree with your argument, Casey, where you're like, we just called these ones late. These ones are active.
And that's probably, and I sorry, but I maybe I shouldn't have said trigger points don't exist, but I shouldn't. But I mean, trigger points are abnormal
as a pain generator.
Yeah,
as a pain generator.
I think if you palpated me right now, I bet you'd find some trigger points, and I'm sitting here without pain. I think trigger points are a daily byproduct of life.
I agree.
Sometimes I will have. Sometimes I'll have end plate noise. Sometimes I'll have a little inflammation. It's not that big of a deal. It's not the problem.
And when we went to our course, I would argue I was not in pain, but Doling, you lit me up like a Christmas tree. I mean, we found every single muscle group that we tried, we found trigger points and got a twitch response even. Yeah. So that would be a piece of it for me that makes me a skeptic.
Yeah, and I will say, however, when I took the course too, Jan Damerl taught our course, like a pretty big name. He used me as the first patient. He was like, who's got, dominant upper traps? And I said, well, I'm pretty beefy. Like I got big traps. Right. So he palpated them and he's like, oh, these are pretty serious trigger points. Right. Cause I'm like, oh yeah, that's killing me as you're, rubbing on them. He needled the hell out of both my traps because he was so frustrated. He needled my one and got no twitch response. He needled my other one, got no twitch responses. He's like, I've never not gotten twitch responses in a trap. And I was like, well, that kind of disproves your whole talk. But you were saying that.
I don't think that disproves it though, because you said yourself you were symptom free. I don't think that we need to be needling everybody just because I know the point. Like traps are, god dang, 95% of what I seem to needle are like traps and shoulders. And even if I'm just doing a parascapular, I do the traps because I'm like, there's probably going to be something there.
Right. Now, if you're looking for it, you're going to find it.
But at the same time, that doesn't mean we need to go create stuff either. So I'm not disagreeing with you on that, but I'm also going to say I don't think it debunks it though either, because you said yourself you're pain free. Like you probably, if you go snooping around that doesn't mean you're always going to turn up stuff.
Yeah. Can't we say that our treatments are effective without saying they're treating trigger points? I mean, if I have somebody that's got pain in their shoulder and I put a few needles in there, I mean, can't we agree that that's going to cause descending inhibition in the brain? Like you're introducing new noxious input to that tissue.
I don't.
Like,
I think that's part of it. I just
can't your
don't think
body
that
just
explains
shut
it.
that down?
I've seen stuff when I've done it. I've experienced it myself. That doesn't explain the whole situation though either.
Well, and I think, I've said it before. I'm not going to say you guys agree on it, but like needling, man, that is the strongest placebo treatment we can do. Like you put a needle in something and it grabs because you've jammed a needle into it, and you get that
Doesn't grab all
myotic
the time,
reflex.
though.
Not
I
all
mean,
the
it doesn't
time, but
grab
it's
all the
some of the
time.
times. I
Yeah.
can guarantee
And
you can take a needle through my whole body right now and get 40 or 50 twitch responses in random muscle groups. So that's a great placebo effect. If you feel like you find a trigger point and you try to needle it and it doesn't get a twitch response, do you just say, well, that was the trigger point I felt, we're moving on, I'm not going to do any more needles? No, you try other spots and you work to get that twitch response, because that creates a strong placebo effect, combined with descending inhibition, because you've now put 4 or 5 needles into somebody and created some tissue damage and some noxious input that your body knows is not that dangerous. That's the nice thing about needles. They're not that dangerous. They're thin.
Yeah.
They don't cause much more damage than, they're less noxious than a paper cut. So your body's able to send that descending inhibition, shut down pain to that area a little bit, which has a carryover effect from what the actual underlying issue is, whether it's mechanical. I know you guys like regional independence, mechanical issues, and allows you to move easier, right? Like, can't we just say, hey, I'm going to give you a way to move easier. Like, this is going to shut down some of that pain so you can move easier.
Sure,
What you're
but
doing
patients
is
want
not
more.
creating trigger
They want more
points.
understanding than that. Patients want more understanding than that. And I
But do
think
we have to give them? That's what Travell and Simmons did. They created
But that's so
understanding.
long ago. That's antiquated. That's so antiquated.
But we're still
It's
using
not like,
it.
But I'm telling you, there's still like evidence. So if there's evidence to support it that's coming out fairly recently, I'm not gonna avoid that because some other counter evidence is saying, well, it doesn't necessarily exist either. I going back to your point, some people are gonna, how do you rationalize why you can go into 90 people's traps and get, fined, especially if you take your time and you're more specific, you will get those twitches. And yet then you go into somebody who's relatively pain-free, you're just doing it because you're already needling some other structures, and you're going to say, let's just see if we got anything. And there's nothing. So then why? So again, if they don't exist, why do some people get that type of twitch response and other people don't?
They're normal. They're located everywhere in your body. You put needles into people, and sometimes you're going to find spots that make them twitch. It's a normal response to getting needled. I would say the same argument the other way. You find people with painful areas, and you needle them, and they don't always twitch.
Yeah, I would go into here. Here would be my take. Is as far as I know, we're out of our shtick, but this would be just Jeremy's take, not the judge's take.
Yeah.
In no word is it the final, like in no way is it the final word.
Yeah, no, but you need to weigh in too.
I would say what you hit on, Nick, is very important. Multimodal approach, right? And you referred to it too, Casey, where you say, like, can't we just say this is a way to get you moving better? And I think we can, right? I don't think it should be. I don't think it should be the basis of what we do. But but then I also have this internal struggle too, where placebo or not, if somebody dealing with chronic pain comes in and says, holy smokes, I have relief, holy smokes, I was able to move better.
Yeah.
In today's medical environment where, right, opioids are still rampant, even with
73% of spine surgeries don't work.
Yeah. So then I go, that was kind of what I was alluding to, where I say, does it matter? And to say, like, man, if we can use this as a tool, and that's how I'll try to explain it to everybody. I did it today.
Yeah.
I used some A-stim today. I used some dry needling today, and I said, hey, whether it's the tool, whether it's this rock blade, whether it's this needle, whether it's exercise, all we're trying to do is improve blood flow, reduce the inflammation, get you moving. And she was like, yeah, awesome. Right. But still, she was like, oh man, I feel immediate relief. And you go, again, to me, I'm like, still just cynically in my brain, I'm like, did it do that?
Yeah.
But it's getting her moving. So that's where I ultimately look at it too, to say like, yeah, I think messaging matters 100%. It's not for everybody, but it can be a really valuable tool.
Yeah.
Especially go ahead.
And I would agree.
I just need to clarify.
Go ahead.
He said, yeah. I'm just going to clarify my point too. I don't go in. I think if anybody who works with me down here in Marshall, where I do almost all my needling, if they're listening, they can kind of testify this. Like, I don't go into any treatment as like, this is the cure that's going to treat you. You know, this is the tool that's going to bust up all your trigger points, and you're no longer going to have pain. You know, I really don't approach it that way. I feel like I was highly skeptical of trigger points prior to my level 1 DN course. Kind of like Jeremy was saying.
Dry needling
I thought
is what DN stands for.
Oh, thank you. I thought it was, a little bit of voodoo. Very skeptical, and I'd look through the books where they have the referral maps, and I'm like, does it not? I don't know. But to something that Jeremy mentioned earlier, being on the table and experiencing various forms of, referred pain when people would hit latent points on me, really created my own personal buy-in or bias. And then by the end of that session, I was feeling it was a strong intervention. And I know Jeremy's aware of this, but I'd been kind of battling about a 4 or 5 year history of right buttock pain when I'd sit and drive. I think I've shared that story, right? And I couldn't make it more than 30 minutes without having to do this number where you relieve pressure, press myself up. And I kept thinking it was like some type of perhaps nerve root impingement, something old. And they asked for, demonstrators, somebody to demo hamstrings. And finally it was day 3. So I said, sure, yeah, might as well. And he did my hammies, not my glutes, but my hammies. And if you remember that, Jeremy, they just didn't stop twitching. Like, he hit 4 or 5 points and they just didn't stop. And I can remember people asking him, like, well, how long do you keep going after it? Right. And he's like, this guy's been putting up with it for a long time. He's going to want me to get rid of it. Right. And he's just pistoning like crazy. And I get off the table finally after he hits all these different levels, and I had just pure jelly leg. And he went over, he's like, do some like deadlift patterning, put some RDL stuff, put some tone back into it. And then we went on our way, right? We cleaned up the clinic. I mean, pretty much closed shop, cleaned up the clinic. And I didn't really think much of it. And about probably 3 or 4 weeks later, we take the kids to the Wisconsin Dells for NBA break. And, like always, we were driving, and we were about 120, 150 miles from Marshall before we finally stopped. And I get out, I'm gassing up, and I just didn't say anything to that point. But Michelle goes, you're not like in pain. And I said, yeah. And I said, funny. I get back in and I start driving like the rest of the way, and we're talking about it. And I said, that's the only thing I've done different in the time since. And that, to me, as I started thinking about it more, I'm like, and I really haven't had anywhere near the same degree of like that similar buttock and posterior chain pain that I had since then. Really never came back to that level ever.
Casey?
Yeah, and I would say, yeah, I hate to say it because you were a skeptic, but they built it up a little bit of placebo effect. But then he nailed you, and what did he have you do? He had you do the things that were probably irritant for you, and you taught your body that that's okay, for the short term.
He didn't have me sit in my truck for 2 hours.
No, but he had you do other things that you were like, okay, those used to hurt, and now they don't.
But that nothing hurt. That's what I'm saying. Nothing hurt other than prolonged sitting.
Dun, dun, dun.
So, and I know it's kind of a crap level evidence because it's just my own case study. But when you experience something like that yourself, and you have a pretty profound outcome that's now 5 years, almost 5 years in the past, I certainly have have an appreciation for it as an approach. Now, whether he was truly going in and breaking down myofascial trigger points, with that treatment, I don't know.
Yeah. And like I said, I'm not here to argue dry needling per se. And, it's hard for me to believe the trigger points in your hamstring were causing all that trouble. But, you sat through 3 days of placebo education, it's just, and I think we know the narrative in medicine and we have to be prepared to treat it. Right. So I don't think you're a bad therapist for using trigger point directed interventions. I did it the other day. A lady came in and she had a ton of middle back pain, leg pain. We did mobility stuff. We did some calming techniques and it was all fine. She's like, all I have is lateral flank pain, like right here. Right. So I did a little soft tissue mobilization. Ischemic pressure because I just don't treat trigger points much. So I don't have as many tools as you guys have on hand. But she was like, wow, that's like the best treatment I've ever had. Like, I mean, but I still don't believe that was the problem. But again, the narrative is so strong that if you don't address it, patients aren't going to get better. So I think dry needling is fine. I think foam rolling, it's okay. All right. Like I think ASIM's fine. I think Raston's fine. I think if the patient comes in with the expectation of they've been told by 5 or 6 different professionals that they got myofascial pain, they got trigger points, they got knots. My significant other massages me and he says it's so much tone and there's so many knots. Like you have to address that, and I'm not denying that. I just think as therapists, we need to change the narrative. And instead of having the patient come in and go, yeah, you got a ton of knots, these techniques will remove your trigger points and you'll feel better. Like, I think we just need to change the narrative a little bit. So the patients realize that like, it's not the trigger points causing their pain. It's, inflammation, lack of movement, whatever the loading was that you never just got your body back to normal movement, fear movement, whatever it is, because again, every research is going to go something plus exercise works great. Something by itself doesn't work very good, right? Like we just need to move people better. So if trigger point therapy is great at getting moving, awesome. Like, but don't perseverate that same narrative so that another 20 years we're still doing these same trigger point treatments. It's no different, like I said, then it's not a straw man argument, but just a comparison of my SI's out, let's do a muscle energy technique. Those muscle energy techniques did work. I used them on patients when I started, but that narrative of your SI was rotated and I put it back into place by using your muscles, the same muscles you're going to use walking out of here and going up and down the stairs. But somehow that didn't put you in and out. It's just that how we change.
But then some people counter by saying you shouldn't do that. You should have restricted movement after doing that.
Yeah, belt it up, man.
But then you're kind of debunking, and we don't have any disagreements here. But if you're going with a purely biomechanical one, obviously, I don't think any of us disagree with that.
No, correct. Yeah. I think when it all boils down, it's just narrative and how we go about what we do works. I don't deny that. I've said a ton on this podcast. Like we have very, very good results with dry needling. We have very good results with pain science. We have good results with these things. It's just, can we maybe change the narrative a little bit? Can we empower people instead of creating long-term, can we take that placebo effect to empower people instead of taking
how you empower someone
to create nocebo,
you buy it, you get them to buy a foam roller. That's how you empower somebody.
For sale in our clinic for $35.
I got my final point on this before we can move on to top 5. I promised somebody I'd give them a shout out today. They felt lost. They felt left out.
Are they following us though?
Yeah, have they liked and subscribed?
So Ashley Holm, our phenomenal PTA down here in Marshall. She's been
what up, Ashley?
Like
PT Shop Talk.
She said she felt a little heartbroken. She hasn't been name dropped yet, so we're gonna name drop her. I think she'd be okay sharing. I've dry needled her shoulder and upper trap a few different occasions, and have had pretty profound successful outcomes with that, short-term and long-term. So there's my shout out for Ash, and somebody will maybe get on the pod down the road, talk a little health coaching and stuff like that.
She can talk running too. I can second that. She's beast mode. Like I got to work with her for my first 5 years of practice as well. So Ashley.
I don't know her at all, but Ashley, you seem awesome. So shout it out.
Legit one of the hardest working people I've ever met in my life. So big
That's
shout
for
out
real.
to Ash. Yep.
Ashley, if you're ever through Fargo, I will buy you lunch. I promise.
There you go. Gluten free.
Call me on it. Oh, there's lots of options in Fargo. We'll find something.
Yeah, lots.
Speaking of gluten free,
Is
is
that
that something you need on
at a
your
barbecue?
holiday barbecue bash?
I need extra
Huh?
gluten. I need tons of gluten when I barbecue.
I need all the gluten.
So you're not double fisting brats. It was a wrong nickname.
No.
I pictured you as like a dude where you're like, no bun, just like a burger. You're just sitting at the table eating a burger without a bun.
Cutting it
I'll
up
do a
into
bun now and
pieces.
again, but I'll do a bun, but I'm in heaven if I got 2 patties on that bun. Man, I need like the meat to bun ratio needs to
Like you're talking patty bun patty, where you're using the bun as the patty and the patty as the meat.
No. Just saying I need
I
like
wanted to
2.
clarify.
I need like a couple at least, third pounders, couple third pound patties on there, like bun, patty, cheese.
Okay.
Okay.
Not gonna
Patty,
argue.
cheese,
Okay.
bun. So get you with me? That's
So
like
you
a
have
perfect-
Patty cheese.
you have equal patty to
cheese
cheese
bun.
ratio.
Yeah.
so that's
You should.
so there's only
I'm a
so you
2
got
to
the
1 guy. I'm not gonna lie. You need 2 cheeses to 1 patty. That lets her slide down.
That's all right too. I ain't gonna
Yeah.
hate on that.
I don't
But
know. Have
I
have you guys ever had a sandwich that was like too cheesy? Where you're like, it's too much damn cheese on this thing. I can't
have.
enjoy it.
I
What?
actually have.
A liar.
And I didn't think I
Liar.
could, but
Tell the
No,
story.
it's-
Tell the story, because I didn't think that was true as well.
no, it's like Michelle's like amazing at making grilled cheeses.
Okay.
And I've kind of thrown my hat in there too, trying to learn from her. And one time I thought it was just gonna be so great because I'm like, she uses like for normal slices of bread, she'll use like 3 or 4 slices of cheese, right?
Solid
And I'm
ratio.
like-
I would agree. 2 to 1.
I'm like, yeah, that's amazing. So I'm gonna go like freaking 7 or 8. And
Okay.
I did that, and it was just like crazy rich. Like you get through it, and you're like, oh, okay, maybe that was a little too much of the good stuff.
So your after was bad, but how was the during?
No, I mean during, like I got like halfway through the Sammy, and I'm like, oh, okay, I probably overthought this thing, and it's maybe a little too much.
Hard to believe. I'm gonna need one next time we're in person. I need a Nick
right,
Doling 8
I'll make
cheese
you a
grilled cheese.
8 cheese grilled cheese.
I'm gonna bring a little griddle next
Hot
time
plate.
we get together. You're instead of a working lunch where we order in, you are
So
hibachi
here's my
chefing
question
this
though,
thing.
like we also have this was called like we kept it pretty broad, right? You guys were like outdoor gathering essentials as well. So
Yeah.
like, are we talking games too? I mean, what are we talking?
Yeah.
I said, if
games,
you're
food.
gonna have a party in your backyard outside,
Mhm.
what
Gotcha.
do you need? What do you need to feel good about that party?
All right, love it. Is there any way we could pause the pod? How do we pause the recording so I can step out for a moment, come back?
I mean,
And we just edit this part out.
Yeah, I think I can pause. There's a pause button. You guys want to take a little tinkle break?
Yeah. Somebody go first.
We're back. If you're listening on podcast, I don't know if I'm going to edit that out or not. If you're watching on YouTube, for sure not going to edit that, because video editing is like 100 times harder than audio editing for those that haven't tried it. But we are back. So we're going to hit our top five requirements for barbecue outdoor gathering essentials. I think I might as well kick it off, being I'm talking and I love to talk, as you guys know. So my number 5, and I think this is going to be a fun list, is I think if you're going to have just an awesome outdoor barbecue with anybody, you got to have like the big ass metal bucket of ice and beers sticking out of it. I just feel like it's such a like grade school I'm not trying move, just to have like coolers on your deck. Like, oh yeah, go into the cooler and see what's in there. Like, you have that sweet ass metal bucket with the handles that have no purpose. And you've bought way more ice than you'll ever need, but the bucket sucks at keeping ice from melting because it's not a cooler, but it still looks badass. It's like, this is a dude that doesn't care at all about spending money on this barbecue, because he is going to melt that ice in like an hour. but he doesn't.
That's
And here's
Good
all the
point,
drinks
yeah.
he has. I got 3 beers. I got a White Claw. I got a Boone's Farm for Jeremy in there. Like you've
White Claw.
shown, you've presented it, and as you're cooking, you're like
Claws.
adjusting it so it always looks good. Man, as an adult, as a college kid, I would have never thought that was a thing, but as an adult, that thing's baller ass. I got one from a silent auction. Never not have one out.
No,
That's my
you're
number
right.
5.
Very aesthetically pleasing.
Oh,
very,
it's so
very
good. Like
there.
when you show up on the deck and you see that sucker, you're like, I don't even have to ask about drinks because
but I'm a cheap
obviously they're
cooler.
presented to me. Like,
You know, that's cool. That's cool because like help yourself. I like where you're coming from.
yeah, it's like a little bit of ad. Like here's like the 8 things we have. Just go ahead and grab. You know, I'll
I'm like a
take care of
cooler
it.
guy.
I'm the
I'm
host.
just give me a
I'm gonna
cheap
refresh
Coleman
it.
though. I want to keep my stuff kind of chilly. Like because
You
like,
can still
as far
have
as-
a Coleman. That's where you pull your supply from.
as far
like-
as like a
Because I'm gonna have
domestic
4 or
light
5
beer.
beers in there, but I'm gonna have the other 20 on ice in the cooler.
No, I'm not going to disagree with your aesthetics of it. I'm just saying the practicality of it. Because if I'm going to drink, domestic light beer, which I will in the summer, I'm like, man, there's just something about it being ice freaking cold, and there's something in the middle of the day, like on a beautiful Saturday when you could start at noon, and not a care in the world. Yeah, it's just so good.
Oh man, you got that ice bucket. You take the neck of the beer and you give it like a 10-second spin before you pull it out of that ice. That sucker's gonna be colder than anything you pull out of that.
I ain't
cooler.
bad either. I ain't mad at it. All right.
I'm just saying that's my
I'll
number
go- I can
5.
go-
Grow up, guys.
I
Grow up.
can go next and save Jeremy for the big crescendo.
I love it.
Oh, this is gonna be huge.
My number 5 is just the old classic staple beanbag or cornhole game, as some people like to refer to it. There's something just very inclusive about the game. Pretty much anybody can play it. If you got kids, you could shorten the playing field a little bit. Everybody to some degree understands it. I think to this point, the point scoring is fairly well established and appreciated, understood. You get 3 for in the hole, 1, on the board. Most people get it. You don't have to break it down nonstop. Sometimes there's some rules in like canceling out, or if you go back to, if you bust, you go back to 11, right?
skunk
Some of that.
rules.
Yeah, you gotta
Yeah.
agree. That's a
House
gentleman's
rules.
agreement before that first
House
bag
rules.
hits the air.
Yep. And there's ultimately always going to be some of that creeps up after you're playing. Somebody's like, "Oh, God damn it. I thought we busted to 15. I'm like, what the hell? Bust to 15? That's stupid shit. You're going to 11.
I like it. Okay.
So that's my number 5, beanbags. And I have a very, very nice set that was a fancy little gift I got a few years ago.
Ooh.
Yeah, that's my
Fancy beanbags.
only problem with bags. In my job is to S on stuff on this show, so I'm gonna jump into it. I just feel like there's like too high of a barrier to entry with bags. I don't own bags just because I'm like, like $100 for a bag set that I'm gonna have to like put in my garage somewhere and like take out. It's like
There you go, Jeremy. Let's
Like-
go in on a PT shop talk.
Bag set.
Bag set for
if
Casey.
you guys are looking for a Christmas gift, that'd be great.
There you
We
go.
can redo our list because bags is not on my top 5.
What?
So
Who
that's where
are
we're at.
you?
I don't know. I'm the guy with a metal bucket of beers.
I don't mind that. I don't mind that either. All right, Jeremy, number 5.
Number 5. I put lighting and a fire. Reason being,
Good call.
any good barbecue is not just ending at 6:30, right?
I like
you
it.
just
I like
you
it.
got you just
I do
gotta
like
have the
that.
ability to take it where it leads. So
When does the sun go down in Green Bay?
we are right on the western edge of the Eastern time zone. Say that time 5 times fast.
Western edge of the Eastern time zone.
Yeah.
That's one time. Now
Yeah.
I'll just edit it to where I put that 4 more times. Go on.
Oh,
So
good,
what
good.
time does it get dark over there? Like
You-
9?
It's very light out. It's a little after
Yeah.
9 right now, and it's very light outside. We could be playing bags right now
Oh,
without
that'd be
without
fun.
lighting. Without
PT
lighting.
That'd be
Shop talk.
fun.
That's my number 5.
Yeah, it's
Love
a
it.
good 5. I don't hate that. I love a good fire.
Yeah.
Are you guys like fire pit guys, or are you guys like propane fire guys, like heater table
Doling's
guys?
probably a solo stove guy. You got one of those
No.
smokeless solo stove?
Smokeless, yeah. I've just had a patient today talk about the old smokeless thing. I like the
We-
smoke.
No,
Yeah.
we were a fire pit for
It's
a long
cool.
time. We
Yeah.
went through 2 fire pits at the old place, and then
What are you
it was
putting in your
last-
fire pits? Animals, I assume.
No, they just corrode.
burn
Like,
through these things.
if you leave
Holy
them out,
moly.
like they didn't. None of them had like a
Cattle.
good cover, you know.
Mm.
So they get corroded. I think
Oh, yeah.
no matter what, they get,
Yeah, you gotta
kind of wore out.
flip them up and cover them for sure.
Yeah. So, but Michelle went out and bought this really sweet propane one with the nice rocks, you know, and
Yeah.
we moved that to the new place. That thing's legit. It just goes through propane pretty quick. That's my only knock on
Yeah. I have both.
It's
And,
not free.
it.
Like I love the fire pit because I love the smoke. There's something about like sitting
Yeah,
on that
when
fire.
it's clean smoke. Yeah.
Yeah, and
When it's
like I
not
have
damp
just
wood and
so much lawn crap that I need to burn anyways. And a
You don't want
cat,
that dirty
right?
smoke. You don't want any
So-
of that
Plastics
dirty
in there.
smoke.
Yeah, Nick's just
carcinogens.
putting his garbage in there. Like, you gotta do something with it.
Plastic and animal carcass.
I grew up burning garbage. I'll admit
I did
that.
too,
Like,
100%. If
burn
the
garbage
EPA
in
is
North
listening,
Dakota.
go after my dad,
Oh.
not me. I told him not to. Yeah. Yeah, no, that's good. I love lighting. I just put up like those huge ass like LED like bulb string lights around my deck.
Nice.
Oof, man, that I sit out there sometimes by myself. It's just pleasant when it's dark. So
Nice. I like
Nick-
it, guys.
Nick knows I'm emo. I like sitting out in the dark. So my number,
Listening to Dashboard Confessional.
yep, simple plan. My number 4 is like a kind of a recent addition to my outdoor party list because this thing would never have been on my list earlier, but now that I have kids and technology has changed, my number 4 is water balloons. I don't know if you guys have partaken in like the new water balloon technology where it's like you can fill 50 water balloons in 30 seconds. It's unbelievable.
100. They make
Yeah, or
100
100
ones.
or 300. Like
Yep.
they make these huge suckers. So literally, and they tie themselves. When I was a kid,
Yeah.
if you wanted a water balloon fight, you had to spend the evening preparing
They
to have a
tie
water balloon.
themselves.
Yeah, they
Yeah.
tie
Yeah.
themselves.
Yeah, they have like a little rubber band, really
Yeah.
tiny. rubber
So
band.
once they get to a certain weight, they fall off the hose and they tie themselves. It is a game changer because not only do my kids love it, and I can like they can literally just run around
Yeah.
and throw water balloons at themselves. But like adults love it. I'm blasting my kids in the face with a water balloon from 20 yards away. It's hilarious.
Now, I have an objection because you're gonna have more stuff to burn when you're done with that.
No,
and
I have
those-
this dog now, so he just wanders around and eats all the balloons.
No, I'm talking about the little device that you attach to your hose, though. The
I
little
think
plastic
that's
thing with all the
recyclable.
straws.
I'm gonna
Yeah.
I'm gonna be a bad guy. Say like I just throw everything in recycling. Now let the recycling place deal with it if it's not recyclable.
We end up
Uh,
with tons of those things just like laying around though.
Yeah, but they're kind of fun. You can still like put them on the end of the hose and like spray the kids with them. Like
Mhm.
it's kind of like a
Mhm.
poor
Yeah.
man's sprinkler. But yeah, you can take like
True.
30 water balloons, throw it on your trampoline. Kids can jump around. Like there's just so many uses for these water balloons. It's a blast. Like you want to
I'll
play
give you that.
bags with water balloons? Go ahead. You can throw that through the hole. If it bursts, you don't get any points. So yeah, water
Oh,
balloons.
not my nice set.
Not your nice set. But yeah, like the cheap $20 plastic one that sucks that you hate using, there's an actual use for it now. So yeah, my number 4, water balloons. It's a game changer.
Like
It's
it.
fun.
I'm old. I'm the old crotch. I'm in my 40s now. I can be old and crotchety. Like, yeah, take care of my board. Wipe it, gloss it.
Yeah, just waxing it with like surfboard
yeah.
wax.
Gotta take care of it.
Yeah, the bag hits the bottom and ends up 30 feet away.
So
These weren't
so
free.
yeah, I know. Dang it. Mine's gonna get a little food heavy coming up.
Oh,
Starting
I like
with my
that.
number 4. I got the some people armadillo eggs. but
Oh, yeah.
really just the bacon wrapped jalapenos with cream cheese
Mm.
and
People
slap
call those armadillo eggs.
I
No.
can't remember.
Oh.
I think armadillo eggs are wrapped in
Armadillo
sausage
eggs are-
too, right?
Yes.
Yeah.
That's the real.
Yeah, then you add that's so I'm gonna update that and have the armadillo egg because we've done that a couple times where you wrap, then you take that and wrap it in sausage, and then you wrap the bacon around it.
Yeah.
Give it a final little coating of barbecue sauce at the end. Such a legit appetizer. Just
Don't you
nuts.
usually smoke those?
Yeah.
Yeah, right.
fantastic. So if you got a larger cut of meat that's going to take a while, in your bottom rack, you put all these things on you prep them, throw them on your top rack. They're done in like less than an hour, and people love them. People eat so much of that damn stuff that by the time the real encore comes on, it's like hardly anybody's hungry anymore.
Yeah.
So armadillo eggs, baby. Number 4.
So I had a hard time hearing that. What exactly is an armadillo egg? That's something wrapped in sausage and bacon.
So you take your jalapeno.
Okay. Yep.
And Michelle's better. She's my perfect. She's awesome. Cuts them in half, cores out all the seeds and all the center, right?
Okay.
And then you put your cream cheese in there.
Okay. I'm following so far.
Then you take and you kind of encapsulate it in a thin coating of sausage, ground sausage. The good
How thin are we talking? Like 1/4 inch?
Well, you can go as thick. I mean, you can go as thick as you want.
But I have to imagine, like the cheese sandwich, there is a diminishing return situation.
It's still meat though. So
jalapeno doesn't get as cooked in, because you want the inside to be crispy or soft.
Well, you're gonna want that to be pretty gooey. You're gonna want the cream cheese to be kind of melted, right?
But what about the jalapeno?
The jalapeno is not gonna get crispy because it's encapsulated by the sausage.
So that sucker's.
It's gonna have a nice crunch to it.
Oh, okay.
But
So you still want a crunch.
Yeah. And then but when you're
not
when
doing
you have
like
the
an
sausage
inch of
on
sausage.
there, not an inch.
Probably a half.
I mean, you could. I've seen people
Probably like a
make them
half
like
inch.
damn near like a burger, like right.
Well,
And
that's
then
the thing. They're like, they can be
you can do
could
it that
be
way.
Like
pretty
baseball,
big.
softball.
like the size of an armadillo egg.
Yeah.
Oh,
Yeah.
hence the name. Well, that makes
And then-
sense. All right, now I
and
know.
you wrap.
That was
and you
foolish. My
wrap.
bad.
Not only is there enough binder and all that sausage fat, but then you wrap bacon around. It really holds it together, and give it a good coating of rub.
Okay.
Holds your
You know,
arteries together.
The sodium is going to be high, but
Okay. Now I'm
it's
not
delicious.
like
And it's I think it's gluten free.
okay.
You're
I'm
right.
not a big bacon wrapper guy. Like, does the bacon just hold itself together? Do you like fixate it with a toothpick?
You can do the toothpick. I usually do a toothpick just to be
Recommended.
safe.
Okay. Well, I'm learning. I'm here to learn. That's what the podcast
your
is
your
about.
blood pressure will probably come down somewhere around like the 4th of July.
I'm on so much
Mm.
blood pressure meds that nothing can touch me.
Eat it. Enjoy it.
Okay.
Well,
All
I
right,
just throw a
Jerry.
couple of Losartans in there and I'm good.
That was my number 4.
My number 4 is yard games in general. So bags are a big piece of that. I am a big fan of bocce ball. Not a lot of people like to play bocce. But then another game I was introduced to is called Cube.
Oh yeah,
They'll
with the
call it-
wooden things.
Yeah. They'll call it Viking chess. And the lore is that it stems from a 9th century game that they used to play with skulls and femurs from the people they murdered.
Dark. Okay.
Makes
Yeah.
a ton of sense.
So
Yeah.
I could make a set out of my cat. We've waited too long.
Correct.
A mini set.
Sorry. Yeah, just a little one.
Tabletop.
That could be, that could just be fun
Tabletop.
year round. You would
Yeah,
need it
like
outdoors.
he's the gift that keeps on giving. He's always with us.
Tabletop.
I know my wife's gonna listen, and she is gonna yell at me so much for that statement. I'm sorry, honey. I love the
You
This is
didn't
awesome.
really throw him in the trash, did you?
Yeah, now she's gonna wonder. I'm gonna have to
Right?
show her the ashes. Like you literally went and got like ashes from the grill, right? Like that's
Show
not
me
the
your
cat.
receipt. Show me your receipt.
Yeah, like show me his teeth. Like his teeth don't burn, right? Like he has to have his dental record still. You guys have put me in trouble now.
Number 3.
That's good. Go ahead. Number 3 case.
My number 3, again, old man. This would not have been on my list a long time ago, but I got one 2 years ago and I will never turn back. If you're going to have a rockin' outdoor party, get yourself a canopy. Like go to Fleet Farm, go to Walmart and get just like a little canopy, like a 10 by 10. Because you know what sucks? Like sunscreen sucks. I'm sorry for all of you people that hate the sun and you people that know skin cancer. I get it. But I totally hate sunscreen. I hate putting it on. I hate how it feels. And there's just something nice about throwing a canopy out in your yard. It takes like 2 minutes to hook up.
Yeah.
North Dakota kind of sucks because of the wind, so you got to get yourself some weights. But other than that, what a pleasant spot. And you can actually throw up a mosquito net. Again, North Dakota, Minnesota, mosquitoes suck too. Like, canopy is so enjoyable. And at this age, I have grandparents that come over for events. I got little kids. Like, if you got babies, throw them under the canopy, give them a few blocks. Like, you need that spot. That's pleasant. Previous to the canopy, like, people just have to go sit inside by themselves because, like, man, it's too hot. There's too many bugs. My baby's eating dandelions. So now I don't have any of those problems. So my number 3, a canopy. It's great.
Canopy, smart buy. Yeah.
Super smart buy. If you're ever on the fence about it, just pull the trigger. Like 119 Fleet Farm. Get it.
And it's so versatile. I mean, you use it for tailgating too. I mean, it's a key for tailgating. We always use that for smoke fest and any other barbecue context.
If you're gonna have like little kids, at some point you're gonna have like graduation events and birthday parties. Like, you're gonna use it all the time.
Yeah.
I would almost think you're describing bags when you say versatile. You can use it at tailgating. Worth the buy.
Dig in. Yeah. You're outside as long as you're outside, right?
I don't know. Okay.
I've even played a lot of bags
can fit
in like a garage or a shed. If you
10 people under canopy, 2 people can play bags.
4 people.
4 people. I've even played 6. I played 6, and that gets a little long, but yeah, done that.
Yeah, you might as well just go somewhere else then, because you don't want to hang out with anybody else then at that point. Go on. Sorry, that's my
I'm
job.
Such a competitor. I'm just like
winter.
I'm such a competitor where whoever I pair up with, I'm like, winter stays, and we're just here all day.
Yeah, you never talk to a single person. Enjoy those armadillo eggs, Bill. I made him an egg this morning, but I'm on a roll. I've got 4 pocket holes in a row. I'm not gonna
lose to somebody's shitty aunt.
No you're slapping kids' bags out of the air. Get your weak shit out of here. It wasn't even gonna hit the board.
God dang it. All right. My number 3, back to food, because apparently that's how I really view the world. Just some damn awesome pork spare ribs. When you can, you prepare, and there's a little bit of work to do these suckers right. Been asked a lot of times if you do the 3-2-1 foil, my Traeger always ends up overcooking them. So
Son of a gun.
They cook faster.
Dang.
Get a green
6
egg.
hours. No. I'm pellet bound, baby. I'm married to it. But you get some damn sweet pork ribs. I mean, there's work. You got to strip the membrane. You got to
Do you have to strip the membrane?
You have to.
I used to, and I quit doing it, and I've never turned back.
You know what? When you go to bite through, and you get a chunk of membrane, and it's holding it down.
It's crispy. You've cooked it. It's like a little snap. It's like your jalapeno. Crispy.
Well,
way too much work.
I'm such a lover of these, and I usually do. I have to do more than 1 rack at a time. And one of them I'll leave dry rub, and one I will sauce and let caramelize. If I do more than that, then it's a little potpourri. But huge must, and it's never. I mean, one of the awesome things about cooking and barbecue in general is like when you see other people enjoy your food. It's such a money thing. Like anybody who's tried good ribs, they know it. It's delicious. It's buttery. It's sweet. It's awesome. So that's my number 3, pork spare ribs.
Boom.
Also gluten free.
The trend.
My number 3 also goes on the grill, but also does not have any gluten in it. But it's grilled asparagus.
Wild card.
I tell you what, we are out here in Michigan. We are in asparagus country, and it is fresh season right now. I tell you what, a little olive oil, put it right on the grill.
Mm-hmm.
Great.
Chef's kiss.
Yep.
Guys, is there a food? This would be a whole nother top 5, but top 5 foods, asparagus has got to be in there. That was so atrocious when you're a kid growing up. At some point,
you just love now.
At some point, adulthood, you're like, this is amazing.
Yeah.
Brussels sprouts for sure for me.
Oh, Brussels sprouts are so damn good now.
Yeah.
Do you think people have gotten better at preparing them too, though?
100%.
It has to be part of it. Like my mom would just like,
Boil
bless
them.
my mom. Sorry.
Yeah.
Yeah. Basically, it's like it's on the stove.
Eat
Just
this mini
smells.
cabbage.
I just cooked it with your macaroni noodles, Nick. They'll be fine.
But the way Jeremy laid
Hate
that
to
out,
mess
you know,
two pots up at once.
toss those asparagus spears with some olive oil, little garlic, little pepper.
Yeah,
I
that's
do a little
good.
balsamic vinaigrette once in a while if you
That's
want to
good
change
too.
it.
Oh yeah,
That's good too.
Get some.
That is a wild card choice, but I don't hate it. I don't hate
I don't
it.
hate it either. All right, our first vegetable in the top 5. Way to go,
Probably our
Jeremy.
last.
No, it isn't.
That's a
It
way to
isn't.
fiber.
It isn't.
Oh!
Spoiler
alert.
Oh, my head's spinning. Number 2, my number 2. You got to have something besides the bucket of beers. So my number 2, if you're going to have a little party outside, got to have margaritas. Man, margaritas, they're super versatile because you can do a straight up margarita. You can do a blended margarita. And if you're going to blend, throw some of those virgin for the kids. Like, it's a party for everybody. I've seen my kids get drunk off virgin margaritas because they think the adults are having the time of their lives. Like, oh, dad's crazy. That must be these things. And I've double checked, not alcohol in them. Yeah, margaritas, man, that is a fun maker. That is just
it's so
always
good.
a fun maker. Like, and people love it.
Do
When
you-
you bring the
and you
blender
salt-
out
do you
and they're
salt-
like,
you-
oh, margaritas. Like, it opens
You salt
everybody up.
You salt your rims and stuff.
Yeah, if I'm gonna do it right, for sure. I mean, if it's just me and my
Yeah.
buddies, we're getting ham boned, like, yeah, we're just drinking tequila without the margarita mix. But yeah, like, yeah, the salted rims, the glasses, it's fun. I love margaritas.
Yeah.
They're just a blast. You throw a few different mixes out there, everybody's got a taste of margarita too. Like, and everybody goes, oh, I don't really do tequila. I don't want to get crazy. And then you make one and they drink it and they're crazy and they're having the time of their lives. Like, people
It's
lie
good.
about tequila.
Especially,
Everybody claims they hate tequila until they drink it.
is
Like,
it Mr.
and
and
then they're
Mrs.
like,
T's
"It's
that makes
great."
like the light one?
I've
I'm a big
never had
fan.
a light margarita.
It's like only 10 calories versus like
Gluten-free?
the pure sugar. Yeah, it's gluten free too.
Oh.
The
But
mix
it's
is only
legit.
10 calories.
Yeah, the mix is only 10 versus like all the sugar that they don't like when you do the standard.
Yeah, it's so unhealthy otherwise.
Yeah, I will say I have typically never made like from scratch margaritas with like my own sugar and lime.
Oh yeah.
Like, I've never went that far. Like, if I'm gonna be honest,
Maybe you should.
you're having a margarita, have the time of your life.
You know what
just mix it up and go.
Casey, you know what? Try to add some tahini to your salt on the rim. Tahini is like a spice, like a spice
like
mix.
a little spicy.
And I had that for the first time in Mexico a few years back, and they were I noticed somebody else was walking around with like that type of concoction on the rim. I'll try that. I like spicy. Good God, it
Fire
takes
it
it to
over.
a whole nother level. It's like
I
it's-
didn't
it has
know there
this
was another
cool-
level of margarita.
Yeah,
There are.
there you go, baby.
Memorial Day, baby. I don't got to work till Tuesday.
Yeah, right. All
Fire it
right,
up. Margarita
number
dreams are the best
2.
dreams.
I like that margarita pick. I was definitely thinking about that too. Number 2, I'm going back to the lawn games. I'm picking up the tempo a little bit. This game is hot when it comes to the wrestling community as well. I'm talking spike ball, baby. It's I kind of got turned on to it maybe 4 years ago, and I've just fallen really in love with it. I think it's a good way to get a nice little lather, still have a good time. And, it gets a little, so going back to bean bags, bags, everybody kind of knows the rule, easy. Spike ball, it's, number 1, there's not a lot of people who understand the rules. Number 2, there's like a lot of variability to the rules, and I don't dig that. But when I get going, it's a fun way to stay active. You get a good lather going. It's like you're sweating out your booze.
You gotta have the right group. You gotta have the right group.
Yeah.
That's not a chill game.
I've never
like-
played. This is like adult Foursquare, correct?
Basically, yeah.
Or yeah, like a volleyball net on the ground, like built into a trampoline. You just bounce
It's on
down.
ESPN.
Yeah.
It's on
Like,
the Ocho.
There's
Like
there.
beach spike ball where you're in thongs.
Beach is the best. honestly. Like,
Yeah,
so
beach
you
would
can
be
lay
because you
out.
could dive and stuff. Yeah, you can lay out.
You actually dive in this game? I've
Oh
only
yeah,
because
dude,
like
you should watch
it's not that big of a tramp, right? I mean, we're talking
No.
3
It's
by
like a
3, 4 by
3 foot,
4.
3
4
foot.
foot, 4
It's
foot
square
diameter,
circle,
maybe.
diameter.
Yeah,
Circle,
it's
circle.
like a hula hoop. It's like
Okay.
a hula hoop with a net
Yep.
on it. I mean,
It's
How big's the
man,
ball?
man,
big's the
you play against some.
Yep.
Yep. You play against some young, like
Sorry for those
healthy high
watching.
schoolers.
It's roughly the size of this, which I know didn't help
Yeah.
you. I'm kidding.
Probably.
I
What
don't
do you
know.
think? What do you say,
Grapefruit.
Jeremy? Like again, like 4 inches in diameter, maybe the ball.
yeah.
Yeah.
And I think the net's only like 3. Honestly, like 4. That's
Yeah, maybe that
pretty
could be.
considerable.
Yeah.
So you can
It's
but
play
fun.
yeah.
this
It's
in
fun
your
as hell, though.
driveway
I
if
mean,
you really
you
want
get
to.
active. You can be active or you don't. You can play with like I've had my mom play, and that's kind of fun. You just bring it down. But I've also played against hyper athletic high schoolers who,
Yeah.
even if it's Jeremy, you're playing on the sand, it's a blast. But they're playing in like a rough backyard, diving out and laying out.
Yeah.
High schoolers are impossible to beat in this game. They can move.
Yeah, it's a fun game. I don't deny that. I would just say, yeah, you just got to have the right group. Or maybe that's because I like get ultra competitive too. So I'm like, oh, this is dumb.
Like, do you feel like being like 7'3" with a 14-foot wingspan is a huge advantage in that game?
Yeah.
Definitely.
You still got to move.
Okay.
Still got to move.
We should go head to head sometime.
I've got a set.
All right.
Everybody's got one. All right.
I got a wicked serve. Wicked.
Sav. You
All right.
gotta be a gentleman with your serve though too. There's some decorum involved with it too. But
I play for keeps, baby.
number 2, the vegetables haven't left the list.
Oh.
Mine number 2 is cucumber salsa. And I tell you what, my wife makes a cucumber salsa that it's like, it's summer when it's out there. So it's basically
tell me more. What's in cucumber salsa? I don't think I've ever had it.
It's skinned, diced in the cucumbers, that is. You
not the people.
Not the people.
We did that episode a while back.
And then it's pretty simple from there. I believe it's a can of Rotel, a little bit of cilantro.
I hate cilantro, but go on.
Yeah, you either love it
Tastes
or
like soap.
So a little bit of cilantro, and then it's like a ranch packet, and it is
a ranch packet.
Now you're going.
I'm telling you,
tortilla chips, as the
tortillas.
kids say.
Yep.
Okay.
Yep. If you know, you know.
Yeah, you don't know what you don't know, and I don't know.
At any rate, you definitely have me interested.
All right, that seems crisp. Like I like a little bit of cucumber in my water.
It's cool, fresh.
I'm the DiCaprio meme right now.
There you go.
Yeah. All
right.
Moving on to numero uno. My number 1. I've alluded to it a few times. Man, if you're gonna have a party outside, you gotta have brats. That's my number 1. If you have nothing else, throw some dang brats on there. I say brats because like the only time I eat brats is when I'm grilling outside. I have burgers at restaurants. I have ribs at restaurants. I have chicken at home and at restaurants. I have steak at home, plenty, even in the winter when I'm not grilling. But brats, there's something about a beer or a margarita, brats on the grill. That is my outdoor deal. And you can like, I don't know how it is where you guys are, but where we're at, like you can have 1,000 kinds of brats. You like cheese in your brats? Good. You like gummy bears in your brats? We got gummy bear brats. Like you want cucumbers in your brats? We got cucumber salsa brats. Like you can do anything. Like brats are super versatile. It's the only time.
Pop it in the casing.
Yeah, it's like the only time you ever have them. I think that they're just made for outdoor activities.
Have you guys had brat burgers?
No. Yes.
Brat burgers are good. We should shout out
Hy-Vee.
Hy-Vee. We should shout out Hy-Vee.
Hy-Vee.
Hy-Vee's got the best brats that I've encountered. And they've got brat burgers too. Johnsonville makes a brat burger. It's not the same.
They also make I cooked up some brats that are casingless. So they're
Ooh,
basic.
it'd be
So
the
they're
same
like so Jeremy, same thing. Brat burger,
Yeah.
but they're more like a strip.
Yeah.
And those are freaking dominant. I did some of those Sunday, like
Yeah.
jalapeno cheddar ones.
I feel like I
Yeah.
like the casing. I like the snap.
They, yeah, you're right. But if you smoke it,
Okay.
you get a
That's
little. It's so good though too. They're both good. Yeah.
that's my number one, man. That's how you know you're outside partying. Everything else on my list, there's other events besides outside barbecues, but brats, man, that's what you have at an outside barbecue. That's how you know it's a barbecue.
Hey, brother, I hear you. The only counter I have
Brats,
is that the whole
brats, and whatever
And
Q
more
stands
brats.
for. That's what barbecue stands for.
like you can do it year round, man, because I do dig, like every now and again there'll be a nice like cool fall day where to prepare for a Vikes game, I'll want to take like go to Hy-Vee, like Jeremy's saying, get some fresh brats, like jalapeno cheddar, whatever, and do the beer boil, cook, do that,
Yep,
and then
that's solid.
finish them on the flat top to give them a little
Crisp. Yeah.
little snap.
Little snap.
Because that's a good fall meal too. I'm just gonna throw that out.
No, I totally agree. I could eat brats all the time. My wife doesn't like brats, so like the only time I get the excuse to make brats is like, well, I'm cooking a lot of other food, but there's like this little like 4x6 area
Empty.
with a couple brats on it.
Gotcha.
I gotta fill the space on the grill with something. Brats do a good job of that.
Yeah.
So
Oh yeah. I love them too.
Yeah. Double fist them.
My number one is what I consider to be the king of barbecue meats. It's a perfectly cooked beef brisket. Now it's going to take some work. It's going to take a little time, but man,
all good
alive.
things do.
So I can't tell you boys how many times I've like had people, they've been part of whether it's a family gathering or just little weekend party thing we're doing. And it's usually more females than males, but they're kind of like, I don't like brisket. I don't like, like not like they're vegetarians or vegan. They're just that's not my.
That's too much.
And then you cook it. You give them, and then you slice off. Get them a good mix with a nice little bark to it.
Burn
But it's
ends.
still gonna be tender. Or do the burn ends too. Oh my God, they're like, this is really good. Again, it goes back to the rewarding thing. But when you nail a beef brisket, oh dear God, so good. So good.
Yeah.
Easily my number one food.
Yeah, when you talk about like watching people enjoy the food you cook, like brisket's the number one. Like that's just a food people don't make, right? Like your average person doesn't sit at home and make a brisket. So you're 100% correct on that. There's nothing. Ribs is a close second because people just for whatever reason don't like ribs. But yeah, brisket's like, oh, you made brisket. Like, and I'm the same way. I'm like, this is like the best brisket I've ever had. Like it's and you can't even go to restaurants and get good brisket because they're trying to fire it out too quick, right? Like they're just trying to turn over briskets to do best.
Or I think it's because you got to do it like the place. I've had probably too many conversations about barbecue with people, but like there's guys like Aaron Franklin's considered to be the king of brisket. I think he's based out of Ott. So there's a name drop, right?
Well,
Franklin Barbecue.
Like and follow. Like and follow.
Smash it. I'll hashtag him.
So his restaurant, I absolutely like. Once you build that reputation, his model is the perfect model for a barbecue joint. Like they cook the brisket overnight. It's pretty much ready at 11 a.m. most of them are. They open door at 11, and when it's gone, it's gone.
It's gone.
And the place closes. And so to your point, like what I think happens a lot of times is like if you go to, God name it, whatever chain is gonna, Dickies, right? Dickies was here, and you go there at like 7:30, 8 o'clock at night. You're just swinging through whatever, and that brisket, they might have pulled that out and started slicing it back at like 2 p.m. and it's been sitting there and it just gets dry. And I think that was the issue that I always had when I've eaten barbecue pretty much anywhere at a restaurant. It's you can tell it's pretty rare whenever it's fresh.
Yeah, I would agree.
It's hard to do.
Restaurant brisket's usually dry and not that great. So I think people think they hate it, like you said, and I don't like brisket. I've had brisket, and then they have it at your place, and it's like just super tender and fatty and moist.
So unctuous.
I know
So
people love
good.
that word, but
Moist.
moist.
Take this moisture to the next level, Jeremy.
Yeah, what do you got?
My number one's pretty obvious. It's just entertainment is is what I put it under. So it's just good drinks and music. You gotta have that at a backyard barbecue.
Dude,
Are you like
you guys
a
are-
pull out the guitar guy?
No.
Oh.
No, you're playing
Little
TI.
boombox. Yeah.
Oh,
Little
okay.
TI. Yep.
What's the outdoor setup look like? We're talking big woofers.
No,
I just like
it's
saying that
usually
word.
just like a Google Home or something.
Okay.
I'm pretty.
Oh yeah. Little.
You don't want the
Bluetooth
neighbors
speaker,
to get.
yeah.
You don't want the neighbors to get ticked off, but you want to have some good music out there. So
Yeah, we know you're rocking that thing until the darkness, obviously, with your lighting. So you're
let's go
throwing up TI at 11 o'clock at night. I get it.
if I've got
Yeah.
it. If I have to.
Jeremy's also bald like Vin Diesel, so people show up and you're like, it's family.
It's a family thing.
Family.
I like that. I want to show up now. Little 700-mile jaunt from Green Bay.
Yeah.
Spend most of my time. So
You're right around the corner.
Just across the pond.
yeah, that's what all the UK folks say. Which
Crikey.
fun
Yeah.
fact, we had our first UK listener. We are no longer 100%
What?
American listeners.
We're international brand.
One person listened to one episode. So that's a fun fact for
I'm
everybody.
surprised they weren't hooked. I mean,
We're international. Well, it's too soon to tell. Maybe they'll listen to other
Yeah.
episodes.
And they'll tell two friends, and they'll tell two friends.
I assume
It's
they like
really-
our cheeky humor.
Yes. Oh,
Cheeks.
boy.
Cheeky.
My favorite. Well, thanks everybody for listening.
Yes.
I think that's the end of episode 21. If you guys have any top fives you want us to go over, if you have any topics you want to cover, you want us to go to PT Court over something, heck, email us at
Yes.
ptshoptalk@gmail.com.
Take 'em
If
away.
you want to see me in my tie and suit and Nick in his just grubby normal people clothes for the episode, watch us on YouTube at PT Shop Talk. Obviously, you can follow us wherever podcasts are found because you guys obviously found us. So until next time, I'm Casey Hansen.
I'm
Nick
Jeremy Van
Rowling.
Kloppenberg.
See y'all.
Let's go.